Well, thank you very much, Susan, and thank you for inviting me to speak at this very interesting conference, which I'm very honoured to do. And as Susan said, I'm going to be talking about family life course and intergenerational influences on later life health and well-being in Europe. And this represents work which I've done with a whole range of colleagues whose names you will see on various cited papers. So we know that family influences on health and well-being are very important, including in later life. Older people in surveys identify the family as one of their most important influences on their quality of life, as well as, of course, being a major source of help and care. Studies dating way back from the 19th century have shown that married people have lower mortality than the unmarried, and we also know that fertility and marital histories are associated with health, and that seeing friends and family is associated with lower risks of depression, including in these current studies that has to be face-to-face contact, but we don't know how that might change in the future. And living alone, few social contacts have risks associated with cognitive decline. And of course, those without close family links tend to use more formal services. But if we think of life course influences and even contemporary ones, remember that family relationships can also be a great source of stress and conflict. So they're negatives as well as positives. And as identified by Elder and others in many, many studies, things that happen in one generation affect the well-being of others, and that contextual influences are important too. But trying to study these effects or influences is very difficult, as so many things that everybody is addressing in this conference, because we can't randomize people to, family behaviors. There are many things that are common between families, including genetic influences, environmental influences, as well as any effects of relationships and exchanges. The big problems of reverse causation, because people who, in often studies, for example, find that people who get the most social support tend to have the worst health in older populations. And that's because probably they're getting that help because they need it. And they're very complex pathways, changing influences, and a whole range of selective factors. So this presents a big challenge for research. In terms of the demographic background, much of Europe is in quite a favourable position at the moment, although this is something which is changing right now. Because in many Western European countries in particular, falls in mortality among men have increased the proportion of older people who are still married and reduced the proportion of widows, although there are a lot of differences. And also, basically, those born in the 1940s had very unusually high rates of marriage, early childbearing, and less childlessness than either earlier or lower cohorts. But this is beginning to change now. And of course, we have kind of new things, or relatively new things, like large increases in proportions of people who are divorced, repartnered, and more complicated family structures. So if we look just as an illustration of these cohort differences in the proportion of childless people, this shows results for Britain, Finland, and France. And the different bands show childlessness at different ages, because obviously some people are predeceased by their children, so and it may be particularly more common if we're talking about more people living to 90 and so. But if you look at Britain, for example, you can see that this proportion is lowest for those born in about 1946, in fact, and similar trends, Finland and France. But childlessness now approaching, or in some cases even exceeding, the rates observed for the 1920 birth cohorts. But as I said, these new, or not so new now, demographic behaviours like divorce and so forth are also a big influence on current and future older populations. So these are data just from the GGP, and you can see in Sweden, those born 46 to 50, actually half of them had ever divorced by age 50, and many other countries are sort of following this pattern. And this makes it terribly complicated. I mean, even in people collecting data, identifying what is a child, is the adult child of someone you remarry when you're 60, your stepchild or not. We don't really know much about these things. We do know from many studies that a range of factors tend to be associated with patterns of intergenerational support. And on current studies, divorced men are particularly less likely to be either donors or recipients of support from children or to children. Other things, obviously, women tend to be more engaged in things. Those with no siblings or few siblings tend to be more often likely to be helping parents. There are differences between Southern and Northern Europe. And in general, the more advantaged groups tend to be giving downward transfers and the less advantaged upward. But a lot of variation in this, and things are changing quite rapidly. We also increasingly, and many people have been interested in this recently, I've done quite a lot of work with colleagues, trying to look at how fertility histories over people's life courses influence their later life health. And here there are some direct effects, consequences of pregnancy and childbirth. For example, childless women are higher risks of breast cancer than women who have had children, and there are other kind of specific physiological things. But there are also these indirect effects, the costs and benefits of child rearing, social support, interaction with children, and these can be either positive or negative. So they may accumulated stresses and accumulated supports, but a whole lot of quite complicated selection factors too. And again, these may go in either direction depending on the context. For example, people with very poor health may be less likely to find a partner, but on the other hand, people in very good health may have more other opportunities and say perhaps choose to delay partnership. So there are contextual variations, but basically most studies of certainly Western populations and some other countries too tend to show best health and lowest mortality for parents of roughly sort of 2 to 4 children. And this is one illustration of this using data from the Swedish population. So this is looking at all-cause mortality by age at first birth and parental age at first birth, and parity, number of children ever born, and a range of increasingly more or less complicated models. Basically, some of them all based on sibling comparisons in order to try and minimize various confounding effects. And they all tend to show this highest mortality for people who start childbearing very early, and highest mortality for those who are childless, and lowest for those of sort of parity 2 to 3. And similar results have been observed in many other populations. And one illustration here, this is looking at health using share data. So this is based on a range of, in this case, depression and ADL limitations. And you can see on one looking by differences by age at first birth, women who have children and their first child before the age of 20 seem to do worse on both of these measures than women who delay childbearing. And it's adjusted for, range of things, but of course we can't adjust for everything. And more recently, I think there's an increasing interest too in how these life course influences may shape and be shaped by things like cognitive development. So using data from ELSA here, we looked at parenthood history and cognitive function adjusted for a whole range of socioeconomic and other types of variables. And these results tend to show that the black line, the bottom line, which is the childless, have the worst trajectories of cognitive score compared to those with one or more children. And the ones with 2 children, who are a kind of normative group, if you like, tend to be the best. As I said, these contextual influences may be very important, and in some places you may need to rely on your children more than in others. And we have been particularly interested in looking at differences between Eastern and Western Europe, because Eastern Europe, for older people, of course, experienced this complete change in the sort of context which they were grown up and which they're aging, and have had rather different demographic characteristics from Western countries, in the much higher rates of widowhood because of very high male mortality, and in the past, much lower rates of childlessness than Western European countries, but more one-child families. And recently, high rates of migration among young people. And there may be some kind of mismatch between what older people had expected for their later life and what they actually experienced because of huge political change, obviously, and also much higher rates of material hardship. And we know now that there seems to be resurgence in sort of familialism in many of these Eastern countries. So we tried to look and see, does that mean that children are more important for mental health in Eastern than Western Europe? So again, this is using data from the GGP. For West, we have Belgium, France, Norway and Sweden. East, Bulgaria, Czech Republic, Georgia, Romania and Russia, and a smaller group for longitudinal work. And basically, the results showed much higher levels of depressive symptoms among older people in the Eastern countries than the West, which we know from many studies, that those with no partner had more depressive symptoms than the partnered, and that the effect of that was stronger in the East. Education was protective, financial strain harmful. And in Eastern, but in this sample, not the Western countries, childlessness and having only one child was associated with more depressive symptoms. And in the longitudinal analysis, we found that infrequent contact with children also was associated with increases in depressive symptoms. So that's just an illustration of these results, showing that predicted depressive symptoms by partnership status and number of children, and east is red and west is blue, and you can see differences both in the level and the association with number of children. So one form of intergenerational support, which actually is becoming increasing topic of interest, particularly in the UK, I think, and some other countries, because of things like delayed transitions to adulthood and also contractions in kind of state supports for very old people, is co-residence. And this is perhaps one of the, a really good example too of how these kind of intergenerational exchanges might have positive or negative effects. Because, you can imagine, very much depending on your background and your circumstances, that you would either think it's absolutely wonderful to go and live with your adult children when you're very old, or you might think it's absolutely terrible, And the same perhaps about having your adult children not leaving home or coming back. You might regard this as either positive or negative. So there are, of course, these, disadvantages of reduced autonomy and so forth, possible conflict, and what you make of that will probably depend on your background. But obviously these benefits of companionship, economies of scale, and if we're thinking slightly more broadly, of course there are quite a lot of housing supply or environmental benefits from co-residence rather than everybody living in very small houseways. But the implications may depend on pathways and life course stage. So we did some work, this is just cross-sectional work using data from the European Social Survey, and this is looking at widows over 65 and their happiness and life satisfaction on whether or not they are living with a child. And somewhat, perhaps we were quite surprised basically to find that in general, widows living with a child were happier than those not living with a child. But in Eastern and Southern Europe, it was only if it was the daughter you were living with rather than a son. So there are some differences in that. And more recently, we've been trying to look not just cross-sectionally, but dynamically at the effect of boomerang children and parents' quality of life, and then we're also looking at it the other way round, the child's quality of life. So this work Marco Tosi and I did, that was using share data, and it showed that a child returning home was associated with a decline in the parents' quality of life, but this was very much driven by the effect in Nordic countries, and as you would expect, unemployment and other character of the child also had a negative effect on the parents' well-being, whereas the child getting a partner had a positive effect. And so this is very consistent with the linked lives. And Marco later did work using the Understanding Society, doing the same kind of analysis for the UK. And this showed also adverse effects on parents' quality of life when the child returned home, but it was quite short-lived. So these are the results from the work using share, and these are fixed effects models. And you can see that in these Nordic countries in particular, there's a decrease in the parents' quality of home when the child returned home, which is consistent with the idea that Nordic countries particularly value autonomy and independence. So I said more recently we've been trying to look at this from the other perspective, the effect on the child's quality of life when they return home. And actually, this is quite a topical sort of policy in the issue in the UK. Other people here have done work on, because there's been a terrible kind of shortage of housing, and many young people are living in very poor quality housing, finding it very difficult to get long-term permanent housing. So just as background, this is from cross-sectional data, and it shows the proportion of 19 to 30-year-olds who lived with their parents in the end of the 1990s and 2018 to 19 by various characteristics. And the first thing is you can see that the proportion living with parents was much higher in 2018 than earlier, higher among men, higher among non-graduates. We know all of this, but also that the proportion of young adults with mental health problems living with their parents is high, some kind of 60%, according to these cross-sectional analyses, and that compares with about 12% in the whole population of young people of that age group. So we don't know if this is because they're living at home because they have a mental health problem, or somehow the things that have led to them returning home are associated with poor mental health. So we tried to investigate this using longitudinal data from Understanding Society, and we looked at young people aged 21 to 35 who were included in rounds from 2009 to 20, and we looked at returns to parental home and changes in indicators of mental health. And during this period, about 15% of young adults went back to the parental home at least once. So it's quite a high proportion. So what we found was that the, as you might expect, poor mental health and partnership dissolution increased the chance of returning to the parental home. But we didn't find any evidence that returning to the parental home was associated with a decline in young adults' mental health, which is what we had expected. And in fact, if anything, we found a slight improvement for female employees. And of course, we only looked at people who returned home, and there may be another more disadvantaged group who can't return to a parental home. Their parents may not have sufficient resources, they may have split up or something like that. So these are results from the fixed effects model. This is on the changes in the young adults' mental health. And you can see measured using either GHQ score or caseness or MCS score or various things. There are no apparent adverse effects and possibly some slight improvements for the female, at least on the GHQ cases. So, in terms of summing up or trying to reach some kind of conclusions, we know that this work and lots of studies have shown that family life courses and living arrangements are really large and important effects on health and well-being in later life. Of course, they interact with socioeconomic trajectories and other influences on health, contextual ones too. And intergenerational relationships and exchanges important for younger and older people. Things that happen in one generation affect the well-being of other family members. And contextual influences are important too, as we showed, for example, by trying to compare East and Western European countries. The important interactions with SES, which vary by time and space. So, for example, now in many countries like Norway, fertility is higher among higher income people, particularly higher income men, whereas at various points in the past, that's been the other way round. So it's a very challenging field to work on, and this work has relied on lots of collaborations with and some really excellent research staff who've contributed to it. And that's basically all I want to say. So thank you very much. And I'm very pleased to have been invited. Thank you.